They used to tell us that the body heals from above down, inside out. What does that mean? Well, that means that your feet are the first to go. Sorry about that, but your feet are the first to go. And there are reasons why this happens. So basically, neuropathy was brought to attention during World War II. Okay? What happened in World War II? Well, the prisoners of war were being subjected to starvation, eating a spoonful of rice for breakfast, spoonful of rice for dinner. What was happening? Malnutrition. They were starving. So they were losing toes and feet. So what about you today? Maybe you're in the 50s, 60s, 70s, 80s, but you're eating. Well, you're malnourished, and that is going to affect the feet. What that means is you're eating, but you are not what you eat. You are what you digest and then assimilate. So we got to look at this whole picture and go back several steps to look at the cause of your neuropathy, because maybe you're not golfing like you used to. I remember treating patients that couldn't even walk. They would drive the golf cart, but as soon as they would get out and try to hit the ball, they couldn't, because they couldn't have they didn't have the balance, they didn't have the coordination. Or simple things like walking your dog or going on hikes and trips. I remember this one gentleman, and really amazing man. All he could do was sit in his lazy boy chair every day and just watch TV. He couldn't walk. He was numb. Couldn't sleep. The blankets touching the toes. I've heard so many stories. I remember one of my patients from Price, Utah. He came in. He was like in his 50s. And he would go out with his grandkids, and he could only get out 50 feet away from the truck hunting ducks. And he had to come back because it hurt so bad. And I remember after he was done with the treatment, he walked it 4 miles up and 4 miles back of the river with his grandchildren. I mean, those are the kind of things that we can help you with. But first, we need to do an examination, doing the evaluation. So when you come in, you're going to do the exam. We're going to do the evaluation. You're going to fill the paperwork out. Okay? You're going to come and sit on a chair like this, and then I'm going to have take your feet off. No, I'm taking your feet off. Take your shoes off, and then I'm going to do some different testing. So I have today Melanie. She's one of my staff, and she's volunteered with her feet today. And so you don't usually see people that are this young with neuropathy at all. But I'm going to look at your foot because I'm going to determine where did the neuropathy start. So I'm going to do things like a vibrating. I'm going to ask you, do you feel it here versus here? What feels better? What can you feel more? Can you feel more here, or can you feel more here? These are the kind of things I'm going to do to see exactly where this starts, the neuropathy starts. Maybe it's just in your toes, okay? The interesting thing about neuropathy too is it starts with tingling. It starts with some little bit of tingling. Maybe it starts on one foot and it'll spread to the other foot. Then the tingling will start to be a little bit more painful. And then the last is numbness. So you'll end up with numbness. The problem is if you have numbness, you have to wear shoes, because if you get a cut on here, if anything happens to your foot, that can be infected and you could lose that toe. So I'm going to do another test with this pinwheel. So we're going to take a pinwheel, and I'm going to ask you, do you feel this pinwheel? Okay. They're going to say no. Tell me when you can actually feel this pinwheel. Okay, about right in there. Okay. And I'm going to do that on both sides, the pinwheel test. That's going to, again, let me know where you feel this. And there's the cold. Do you feel the coldness here? Do you feel the coldness here? Where again? Cold, hot, pain, prickling sensation. But the most important is the laser test. So what I'm going to do, I'm going to test the laser to see your foot temperature. This side, the right side, and the left side. Okay? Big toe left, big toe left, big toe right. Then I'm going to do the other side, the underlying side. I'm going to do the same thing. Do the lasers underneath your foot. Do it on both sides. Get a measurement, because here's the problem. If your right foot is 1.5 degrees to 3 degrees colder, you could lose some toes within the next 5 years. If it's 3 degrees or colder, if this right foot is 3 degrees or colder when I test it, it could be within a year. You could start losing some digits. That's not a good thing. So we're going to test you and see which foot is colder. Okay. Then we're going to put you on this machine. It's called the Tesla Max. So what I'm going to do is I'm going to hook up this machine, and we're going to put a pad up here on your tibialis anterior. And then I'm also going to put one on the dorsum of the foot here. And then I'm going to turn this machine on. And what it is, it's a high volt, low amp. It's not going to hurt at all. it's going to literally pump blood flow and circulation in your foot. So we're trying to throw in blood flow and try to regenerate this foot. And then I'm going to give you some nutrients, some supplementation to help with blood flow and circulation that you're going to take in the night and take in the morning. And then when you come back in, we're going to do this treatment again. We're going to hook the pads up and do the same treatment and see how you did. We're looking for a 5-10% response, and then we're going to do it again the next day. And so as we do this, we're trying to see how well you're going to respond to this treatment and with the nutrients we're going to give you to see if you qualify to be a patient here. So these are the kind of things that we're going to do. And I just wanted you to become comfortable to know what we're going to do. Now, I'm not going to take you off your medication. That's between you and your physician, your gabapentin, your Lyrica, your Neuropathy, whatever you may be on. That's between you and your doctor. But with our nutritional program, you'll be able to get off that medication with the guidance of your medical physician. And the side effect of this is you're going to feel better, you're going to have more energy, you're going to lose weight. All these things, your body's going to be a new person. We're going to do this therapy. We're going to do probably 2 to 3 treatments of therapy on your feet to see if you qualify to be a patient here. All we're looking for is 5 to 10 to 15% improvement. Better sleeping. You can now walk the dog around the block, and maybe the therapy is only going to last for a few hours. That's good. That way we know that we can help you. But I'm not going to accept you as a patient unless we both agree that we can help you. So I really look forward to you coming in and seeing me and start your whole new life, get rid of this neuropathy. Talk to you soon.